So my name is Shannan Wilber. I am the Youth Policy Director at NCLR, and my work is really policy advocacy in child welfare and juvenile justice systems, specifically on behalf of LGBTQ youth. I started my career as a social worker. Worked for a few years really with children and their families, primarily their moms. I did that work for a few years, and it quickly became obvious to me that I wasn't cut out to be a social worker. You need to be really patient and work within these systems that are often very dysfunctional. So I wanted to do kind of the same work, but with different tools. So I went to law school, and I didn't really have much of an idea of what I would do once I got out of law school, but very fortunately for me, got involved pretty early in my career with child advocacy. And I've been a child advocate now for 30 plus years, doing a whole range of things as a lawyer, representing individual children for a while, and then I did impact class action litigation, primarily in child welfare and juvenile justice. And now at NCLR, I focus primarily on public education and policy advocacy. It started kind of as reform of these systems, and now I think of it more as kind of transformation of these systems. And you know, you have as a lawyer, I mean, one of the great things about the profession is that you have a whole toolbox, right? You have all these different ways that you can go at fixing problems, fixing systems. And really what you have to do is figure out, one, what's most effective, and two, what you're good at. And so I've had a really great career in the sense that I've gotten to try lots of different approaches, and they all have their, you know, their advantages and their disadvantages. But I think I've kind of landed both in a place that feels meaningful in terms of sustainable change, and also what I personally am good at. Yes, I mean, the way I approach my work now is really working, interestingly, in systems. So if I can, I look for champions inside these systems who I can collaborate with, because I find that that is a way to create change that's more meaningful and more sustainable, because obviously I and my allies and partners can't be everywhere in this country at once. We can sort of plant a seed and hope that it grows. So I work a lot with the stakeholders that work in justice and foster care. And we do that in sort of a variety of ways. We do a lot of training in public education, and not just one-off training, but hopefully the kind of training that we help these systems kind of develop internal capacity to continue the training. There's nothing better than having peer-to-peer training. Those are the credible messengers. I also do a lot of policy work, and so that can be anything from legislation at the federal, state, or local level. But more often for me, it's working with people in child welfare or juvenile justice to develop agency policy. And that's a really interesting process as well, because what you're doing there is trying to get all the players at the table to talk about what's happening right now with queer and trans youth in these systems, and what could be done differently to ensure their health and their well-being, and ideally for them to not be in those systems to begin with. So policies start with non-discrimination, but they really, to be effective, they have to be much more operational than that. People need to know what they have to do in their jobs to help these young people and get to know them. And the third strategy that is probably the newest strategy, but is really kind of catching on in the last 5 years, is what we call data collection, but is much more than that. It's really about getting systems to be interested in who are the young people that they're serving, and understanding all the layers of their identity and their experience, and importantly, their suffering, like what's happening with them, and who are they. But part of that involves talking to young people about sexual orientation and gender identity and gender expression and how those things play out in their lives. And it's an interesting piece of the work, because it means helping people become comfortable talking about that. And many people aren't comfortable talking to anyone about those issues, let alone teenagers that they're working with in their jobs. I formally joined the staff at NCLR in 2013, but really I have kind of a long history with NCLR. As a young attorney, I was a cooperating attorney working on some cases having to do with recognizing primarily the rights of lesbian parents back in the 90s. One of the things about NCLR that drew me to it from a very early time, like back in the 90s, was that Shannan Wilber, who's the legal director there, developed, when he was a legal fellow, the first youth project in an LGBT advocacy organization. So that's how I got really involved with NCLR, was doing those cases with him. And then I was a board member, and I've been very closely allied with the organization over time. We began working together when I was at Legal Services for Children in the early 2000s, really focusing on LGBT youth in child welfare and juvenile justice. So even before I was formally at NCLR, I was collaborating with them, really developing the first national standards, professional standards, because there was virtually nothing in the field. So Shannan and I and Jody Marksimer at the time worked together to develop some guidelines and some professional standards. We did some training together. We launched a project called the Equity Project, which was a national initiative to reform, really, justice systems for LGBT youth. So I'd been working with NCLR for a long time before I actually joined the staff. Joined in 2013, and have been just moving that work to the next step. So the organization was founded in the 70s by lesbian feminists who really saw a need for an organization that was dedicated specifically to legal issues that were impacting lesbians at the time. And there was really nothing else like it. It was called the Lesbian Rights Project. It was a fairly locally focused organization at that time. It's since become a national organization, and the scope of the work, while it started with a focus on basically family law as it pertained to lesbian parents, pretty quickly expanded into the LGBT community more broadly. So the name is a little bit misleading because we work in the entire community. The organization from the beginning was founded in sort of feminist intersectional principles, which is another reason it kind of drew me into working with them. We incubated lots of projects through NCLR, like the Transgender Law Center, which now is a standalone 501c3. And as I said, the youth work, which nobody else was doing at the time. And in the 90s, the youth work was really focused on young people whose parents had sent them off to these residential placements, essentially to undergo what amounts to conversion therapy. These were kids whose parents objected to their sexuality or their gender expression, and kind of got duped into believing that they would be better off if they could be changed, and that there were these interventions and therapies that would do that. So really that was the genesis of the work that we continue to do under the Born Perfect campaign to abolish conversion therapy. So that's a deep part of NCLR's history as well.
The Born Perfect campaign?
Yes.
And what year did you say that started?
I think the Born Perfect campaign started in 2015. It's since I've been at NCLR. But again, it got a name then and a more focused, it became a campaign, but the work Shannan and others had been doing for a long time. And the conversion therapy work there's the sort of formal work that is, interventions by licensed therapists and others who are very open about what they're doing, but there's all kinds of informal means of conducting or engaging in conversion therapy by faith institutions, by other people in kids' lives who essentially are saying to them, there's something wrong with you. You're broken, you need to be fixed, and we can help you. So our work really is, we try to address that full range of interventions, if you will. The legislation obviously can only really control and license therapists, so that's why that piece of it is focused on legislation. But there's a lot more work that's being done as well. That's a great question. I mean, in my work, I talk all the time with people who work in foster care and juvenile justice systems about what that looks like for those children. And I'll give you an example. A young person who's locked up in a detention facility might have a volunteer chaplain who they see. And the chaplain comes through and is essentially saying to kids, and I've heard this many, many times, you're going to go to hell. You're broken. You're wrong. You need to be fixed. So I feel like that there hasn't been much of a consciousness about that by people who run these institutions. They're not really overseeing what's happening with volunteers who come in and what they're saying to kids. Same with staff. Staff will often bring their own personal religious beliefs and other political beliefs and impose them on young people. And you have to kind of keep in mind that these kids are already incredibly vulnerable, and they're in a situation that is incredibly traumatizing. And they rely on these adults for literally their food and shelter. And so delivering those really horrible messages in that setting is particularly harmful. So I think we try to, in all of our work, talk about what this looks like, because a lot of it is education. If you assume that people are engaging in this work entirely in bad faith, you miss a lot of it. Because, for example, many parents will reach out to faith leaders or other people they trust because they're worried about their kids. They're worried about their future. They're worried about what's going to happen to them. How will they ever be healthy, contributing members of society? And, they're just flailing as parents. And so you have to kind of take a more global approach to this and think about, how do we support those parents too? How do we get that information out into the places that will reach parents and support them to understand how their behavior and the choices they make are going to affect the health and well-being of their kids as they become adults. To me, that is one of the most interesting aspects of this work, having done it for all these years. And that is trying to think about not just the fact that queer and trans youth are really overrepresented in these systems, but thinking about why, and sort of moving upstream and thinking about what can we do to interrupt the various pathways into these systems. And a really common one is family and conflict with families, which leads to kids running away, being on the streets, and therefore being in a position where they're much more likely to be picked up by the police or to enter the foster care system. So when we talk to stakeholders in these systems, we try to help them think through what kinds of changes can they make to again move upstream and make these interventions available to families before they get involved in systems. And there's been some really critical research in the last 15 years, I'd say, that that establishes really research that shows how a parent's response to their child very closely impacts their health and well-being when they become young adults. So, for example, parents who engage in behaviors that are accepting of their queer and trans youth, those kids are thriving. They're doing really well, like all kids who have support of their families and other institutions. Conversely, and unfortunately, young people who grow up in families who are rejecting of their identities do very badly. Now that seems really logical, but it was so significant to have this research because it enabled us to work with systems not to try to change people's ideas, because that's not a very good strategy. That doesn't work very well, particularly when people have very deeply held religious beliefs, but to give them information, to simply say to them, are you aware of this? Are you aware of the risks to young people when they're in families who won't let their friends come over, who, don't intervene when family members or extended family members are critical or mistreat kids, or who blame their kids when they get harassed at school? Those kinds of behaviors end up having really significant negative impacts on youth. And it's a way to engage with parents who we assume love their kids. And I think that's a pretty safe assumption. Parents love their children. They want to do what's best for their children. So giving them information and working with them from that point of view rather than trying to change them has been shown to be really very much more effective, and I think has a lot of promise for kind of interrupting that pathway into these really broken systems of care. Well, it's a bit of a dilemma. First of all, I'm a lawyer, so I'm not engaging in these interventions themselves, but my role is to figure out how to work with systems to make sure those interventions are available. So, you have to be creative. You have to really think about what would this look like? And we have some opportunities. There's been some legislation, the Family First legislation recently, that provides, for the first time, federal funds to support families before they come into the child welfare system. And that's kind of a revolutionary concept. It's always been the case that you didn't get to draw down those federal funds until the family was already involved, and usually children removed from their families, which is very traumatic and a result you want to avoid if you can. So what do? We work with clinicians who are doing this work. We try to have it evaluated so it becomes, quote, evidence-based work, and therefore can draw down federal funds. We talk with creative people in these systems to say, how can you make this available to people before they come into your systems? So it wouldn't be my role to actually work with families. It's more, my role is more to think creatively and think about how we can tweak the sort of set of services that are available to families to make them more meaningful, really, and to integrate services that really benefit young people and permit them to stay with their families, which we always want if we can. So the mission of NCLR really is to advance the freedom and the liberty of LGBTQ people across the country. It's a broad mission. We do it through litigation, through policy advocacy and public education primarily. We work in a really wide range of issues. Our sort of touchstone in terms of who we prioritize in terms of our work, we try to think about members of our community that are at the farthest edges, that are the most marginalized, because that's really been the mission and the focus of the organization from day one. So when I say that, we do employment work, we do discrimination work generally. We work with families to help them protect their parental rights, for example. Adoptive families, biological families, lesbian, gay, bisexual, transgender families, families with trans kids who are involved in custody cases. We're one of the few organizations that does that work, and we've done it from the very beginning. We have an immigration project that does primarily asylum work with LGBT folks, primarily from Mexico and Central America, that does incredible work. And so I'm sure I'm forgetting, we have a transgender youth project that works with trans youth in schools, to access health care, in custody cases. So these are all groups of people within the LGBTQ community that are otherwise not really able to access legal services and legal help. And my work fits in that category because these are, multiply jeopardized young people. They are 85 to 90% of them are youth of color. They are from multi-generational communities of poverty. It's almost a given that touching these systems means that you are in communities that are over-policed, that have very few resources, that are overwhelmed and really jeopardized on so many levels. So by definition, the young people that I work with fit in that category of very marginalized folks.
And where are they? What geographies?
So across the country, we're a national organization, and that means we're working, virtually in any place in the country that where issues come up. People reach out to us. We have opportunities. So everywhere. It's really interesting how that works. I'm often working in places that you wouldn't expect me to work. So the red-blue divide doesn't really necessarily define where I work. And in fact, I was talking to this woman from Alabama yesterday. It's often in states or jurisdictions that you might assume would be less interested in doing this work. So, for example, I have a bunch of work in Michigan, which I happen to be from Michigan. And it's one of those states that has a very conservative legislature, which has passed some pretty terrible legislation, but now they have a Democratic governor. And therefore, the agency heads are folks who are more interested and more amenable to this work. So we're working with the Ruth Ellis Center in Detroit and the Michigan Council on Crime and Delinquency and the state agency that oversees the Child Welfare and Juvenile Justice Department to kind of slowly make changes in these systems to just be more mindful of and protective of the rights and interests of LGBTQ youth. So one of the ways that I work with people in systems is to provide them with tools. So sometimes when people begin to engage in this work, they are really overwhelmed because they don't know what to do. And if you go back maybe 15 years when we first started doing this in earnest, the reaction that we get from people we reached out to would be things like, we don't have any gay kids in our system, or why is that relevant? Why should I think about that? Why does sexual orientation or gender identity have anything to do with kids involved in the justice system, for example? We're in a really different place, and a lot has changed over that 15 years. So now I'd say that nationally we're in a place where more often what you hear is, I know that this is a problem. I know there's a lot of LGBTQ kids in our systems, and I don't know what to do. So that's a really different situation, and that presents great opportunities, because when people want to learn and change, obviously you can work more closely with them. It's also, for me, helped me think about how do we create things so people don't have to reinvent the wheel. So one of the things that I've done over the last dozen years really is create practice guides and model policies and documents that people can pick up and sort of tailor to their communities and their jurisdictions, so they don't have to start at the very, very beginning. And as I said earlier, one of the things that I find the most exciting is I don't think we're ever going to just drop the work that is about kids already in these systems because they're at very high risk. But I think while we do that, we also need to collaborate with folks who are shrinking those systems, particularly the justice system. There's huge change happening in this country around reconsidering incarceration as a positive or even meaningful intervention. It's horribly expensive, it's totally ineffective. So we're actually seeing jurisdictions close down youth prisons. And that's an opportunity. So kind of collaborating with folks who are doing that work to really reduce the number of young people who get locked up and therefore get traumatized and whose life experiences are very different. That's really exciting to me. So I'm looking for opportunities to collaborate with folks in other social justice movements that will have a positive impact on the population I work with. And I'm also really excited about people who are interested in that upstream work. So for example, I mentioned working with families, but there's also a lot of really good work being done with schools, because that's another way that young people become at risk of entering these systems, when schools are a very important protective factor for youth. Kids who are engaged in their education just do better than young people who, for whatever reason, are pushed out or run away or just leave their schools because there are such hostile environments for so many LGBTQ youth. And they're also, and we have, again, data that shows this, they tend to be subjected to much harsher school discipline than their straight peers. So we see a lot of LGBTQ youth who have been suspended or expelled, typically either because they're presenting themselves in a way, expressing their gender in a way that is offensive to somebody, or because they have been bullied or mistreated for a long period of time, nobody's intervened, and they fight back. And when they fight back, they get expelled. So those circumstances, so family rejection, problems at school, those kinds of things are, if we can address them earlier and work in those institutions, so to speak, to sort of create affirming environments for LGBTQ youth, we are going to prevent their entry into these systems. So I'm working a lot on thinking about that. So I'm not working directly in schools. I'm more thinking about schools as a primary institution that is kind of necessary for youth. And here's where the beauty of collaboration comes in, because there are organizations whose entire mission is to create affirming schools. And so, for example, GLSEN, the GSA network, and others who are really focused on that work. So I feel like it's my job to really understand the work that's being done and to support it and to talk about it to the folks who I'm working with in child welfare and juvenile justice, to make sure they're aware of it. So for example, a social worker who's working with a trans youth in child welfare system and foster care, they need to be aware of what's happening in all aspects of that young person's life to be able to really help them. And often what happens is they'll be really focused on what we see as sort of classic foster care services, mental health services, what's happening in your placement, that kind of thing. But young people go to school every day. And it's really important to know what's happening in the school in order to, help these kids thrive and survive. So it's not that I'm working directly in schools. I'm collaborating with the folks who are doing that and also making sure that that work is translated to the people I work with in these systems. It's one of my favorite parts of my work, is the ways in which we can creatively collaborate. So I'll just tell you about one project that I'm working on right now. There's an organization called Ceres Policy Research in Oakland. And they're researchers. They do data collection and data analysis, totally out of my wheelhouse. It's not something I really understand. But data, of course, and the analysis of that data really informs policy. So we've been working together in several jurisdictions, and again, not necessarily in places that you would imagine. So we've in a couple counties in Ohio, the state of Connecticut, we've done some work in Florida. We're about to work with another cohort of jurisdictions. And when I talked before about kind of the buckets of work, the data collection piece and the policy development and training, so we're focusing on again, the sort of not very exciting description is data collection. What that really looks like is going into jurisdictions and working with people who are the people who interact with young people on a daily basis, and really getting down to how do you talk to people, young people, about who they are, all the layers of their identity, and include in that sexual orientation, gender identity, and gender expression. So what that work really entails is first having those conversations with the folks in those systems, overcoming their reservations, their reticence, the fact that they're like, I don't even know these words, I don't know how to talk about this, I don't even know what this means, and kind of working through that, which I find really interesting. It's very challenging, but it's also really interesting. And thinking with them about how do you make this work on the ground? How do you get people to have these conversations? And then what do you do with that information once you have it? So there's really interesting questions about kind of who has access to that information, why it's important, and also protecting it from disclosure when it could be harmful to kids. So it's kind of a fascinating balance of do ask, don't tell, necessarily, to kind of round out what's happening in the lives of these youth and how the people that are working with them understand them. So that collaboration is sort of a legal research collaboration. And I also work a lot with people who are really focused on juvenile justice reform, but not necessarily focused on LGBTQ youth. So I've had a long-standing collaboration with the National Juvenile Defender Center in Washington, D.C. because juvenile defenders are the first line, literally the first line of defense for young folks in the justice system. And they're amazing warriors. They're incredible people. And many of them are not kind of up to speed on how do they do a good job representing queer and trans youth. How do they even know about their clients? So again, working with defenders, it's education. Why is this important? Why does this make a difference? How do you have those conversations? What do you do with that information once you have it? So just looking for strategic partnerships that help move this work forward. I'm one person in my organization, so collaboration is what it's all about, is finding people I can work with to kind of move things forward. So we just did this really interesting project last year. We got a grant from, believe it or not, the Department of Justice through what's called the PREA Resource Center, the Prison Rape Elimination Act Center. And the grant was to develop a model policy, particularly for transgender youth. And if you think about who's jeopardized in confinement facilities, trans youth are incredibly vulnerable. And these are very, very gendered environments. You know, you're a boy or you're a girl, and everything happens from that point forward, where you're housed, the clothing you wear, the programming you're involved in. So anybody who doesn't fit into those categories neatly, all of our kids, has a rough time in those environments. So we wanted to create this tool that was a model policy with commentary that sort of helped people understand what should you do and why. So we decided to do it, and it was a bit of a risk. We brought together a group of people who included formerly incarcerated folks, people who run institutions, those folks are usually not in the same room together. And advocates for youth and advocates for transgender people generally. And, there were prison abolitionists in the room. There were, it was a huge range of people. There were about 15 of us. And together, we, item by item, established consensus about what should happen and how to make it work in small facilities, large facilities. Because if you create something that's not going to work on the ground, you're not going to help your client, right? So we wanted something that was going to be credible in the world of institutional administrators and people who had been locked up. So I'm really proud of the fact that this group of people created this policy, and the federal government published it. So it's out there. And I've seen, I've gotten lots of responses from people who are implementing the policies on the ground. And, we've gotten requests for training as a result of it. We developed a checklist for public defenders so that they know how to go into these institutions and look for what should be happening to protect these youth. So those are the opportunities that I'm looking for.
Beautiful. How many youth would you say you serve in a year, or
that's a really good
in
question.
The lifetime of the youth work?
Wow.
Have you thought about that?
I've never thought about numbers. And when, it would be easier to answer that question back in the day when I was literally representing youth one at a time. I'm sort of several steps removed at this point. So what I'm trying to do is get stuff out that impacts as many young people as possible and transforms those systems that they're in. I don't know that I could really identify the number of youth that are affected. It is an ever-changing statistic, and of course that increasing numbers of young people are coming out, primarily because they know the words and they understand the concepts, and it's kind of out in the world, and so they put two and two together.
Your partners are doing.
Yes, I'm sure that's a big part of it. But in terms of numbers, I can tell you that, and this is why I love the data people. I never thought I would be involved so much with data because it sounds so dry and boring, but it's really critical. 20% of youth nationally in detention identify as LGBTQ. That's about, as best as we can tell, about 3 times their representation in the general population. So that's very significant. That tells us something right there. And virtually all of those young people, or the vast majority of them, are youth of color. So the intersection of race and sexual orientation and gender identity really is the place where these are the youth who are being caught up in these systems. That's really important data and information to have. I was just looking at something yesterday that the most recent data showed about 48,000 youth are locked up at any given time in the whole country. So 20% of them, conservatively, are LGBT youth. Very similar data on the foster care side. 19% of 19% of youth in foster care in a huge study in LA identified as LGBTQ.
Just in LA, or?
It was just in LA, which is a huge jurisdiction, and also other studies that have been done since then confirm that number.
Like similar statistics in other places, like a similar percentage in
Yes.
other places?
Yes, there are a few places now that collect that data routinely. There have been other surveys that have been done. I think those are pretty reliable numbers.
And telling numbers, right?
Well, we've seen a huge backlash politically And much of that, unfortunately, has been focused on youth and primarily transgender youth. So just yesterday, I got an email from somebody in my office sort of listing the states that this session have introduced legislation to, in various ways, that will be very harmful to trans youth. Either in the school setting, prohibiting rules that permit people to access services and restrooms and programming and other things consistent with their gender identity, criminalizing physicians who provide transition-related health care to youth, permitting faith-based adoption agencies to discriminate against LGBT people, both foster parents and adoptive parents and children. So I would say one of the biggest threats is the backlash coming particularly both out of the federal government and many of the more conservative states, which unfortunately has in its crosshairs, in our community, some of the most vulnerable people. So transgender youth are really the focus of a lot of this backlash. And I think that's one of the things we're really, really concerned about.
So what are you doing to tackle that challenge?
So we do what we always do, which is we mobilize on the ground, we work with people in the states where this is happening, we try to get the most important voices at the table, and that is the people who are impacted by this. So anytime you're fighting harmful policies, the most important stories are the stories of the people who will be harmed by those policies. So getting young people and their families in those hearings, that's how we've done the conversion therapy work, is having people talk to legislators, people who have gone through this, and the devastation of these interventions. So we do the same thing. I mean, it's really old-fashioned, mobilizing on the ground, working with the equality groups, working with people in those states, creating messaging, trying to mobilize the people who can effectively defeat them. I think our movement is getting better at this. And when I say that, it's partly communications. It's partly talking to one another, and it's hard to stay in front of this stuff because it's like a fire hose of bad news every day. But trying to develop consistent messaging across organizations and across the country, and being able to quickly identify, the likely allies and people who can, through social media, through their constituencies, get people mobilized and respond. So a good example of that has been the work we've been doing on conversion therapy, where we've developed a sort of a toolkit, literally, that people can use to both develop legislation, to support the legislation once they have it, to implement it, which is one part of legislation we often forget. It's like passing the law is the first part, implementing it is the most important part. But that has been a great example, I think, of building a tipping point, building slowly, state by state by state by jurisdiction, and through professional organizations and others who have come on board to issue statements against conversion therapy. This was not even something people were talking about very much 5 years ago, 10 years ago. And almost everybody knows what it is now. And that's because of the effectiveness of collaboration and mobilization. NCLR has been very involved. We have a strategist, Matthew Shirka, who works with us, who is a survivor himself of conversion therapy, really effectively, literally working on the ground in all the states where these laws are introduced. And increasingly now, unfortunately, having to work in states where legislation is introduced to undo the successes we've had with conversion therapy. Predictable, but unfortunate.
You've mentioned some kind of, victories. Can you share some others from this past year or recent years?
I have to say that I feel like our greatest victory in my work is the increased consciousness in these systems about these young people. It's really very dramatic and it's the benefit of having been in a field for a stretch of time where you can see, 15 years ago, people really were not interested. I mean, I couldn't get on the agenda at a conference. Now you don't go to a conference about child welfare or juvenile justice that doesn't have at least one workshop, if not a plenary, on queer and trans youth. So that's a huge sea change. And I think we have to, on the days when this work is hard, we have to remember the incredible progress that we've made, and the ways in which the daily life of LGBT youth is changed for the better because of it. Definitely. I mean, I think that there has been an increased awareness of the issues that LGBT youth face in general, in their families, in their schools, in their communities. The risks that population is subject to because of bias as it plays out in the places in kids' lives that are critical to their health and well-being. There's definitely an increased awareness. And that's where backlash comes from. You make advances, and of course people who have contrary points of view push back. So I feel like while we are really in the trenches right now trying to battle these various efforts to undo our progress, it is a sign of progress that this is happening. I think we know that there are, like, for example, GLSEN has done some great work about schools and looking at what effectively changes the climate in a school. So we know, for example, at this point, schools that have non-discrimination policies that are inclusive of sexual orientation and gender identity and that are actually enforced, kids do better. Schools that have inclusive curriculum that talks about the positive impact of LGBT people in history, kids do better. Schools that have gay-straight alliances, and they're called something else now.
Gender sexuality.
Thank you. I'm still GSAs, gender sexuality groups or alliances. LGBTQ youth do better in those schools. So we know there are things that you can do to shift the culture in a school. The same is true, again, of families and other community institutions. So I feel like we have some really good tools to use and some good strategies. And really, at this point, and there's a lot of people who want to do the right thing. And those are the folks you got to find. Work with those people and just, it's shoulder to the plow. You just keep moving. You just keep one foot in front of the other and pushing these changes in every way you can every day. I guess one thing I haven't said is NCLR has been really fortunate to have some of the, luminaries of our movement in leadership positions. Shannan Wilber is an incredible, brilliant strategist and litigator. And our longtime executive director, Kate Kendall, an amazing, accomplished person that's really led the organization through a huge expansion. And I'm really, really excited that our new executive director, Imani Rupert Gordon, will be joining us in March.
Do you want to just like say that line over again about the new executive director?
And I'm really excited that in March of this year, our new executive director, Imani Rupert Gordon, will be joining us. She is an incredible advocate in her own right. We're very excited to have her join us, and I'm looking forward to working closely with her.
Feels comfortable. For a bit, which is awesome. And then I always try to make people laugh.
Are you going to say something funny?
No,
think
she
I just
literally
made you
just
laugh.
says that.
I think I did
The joke.